honored to meet all of you. It's such a pleasure. Thank you for having me here. I come from a labor rights organization in Hong Kong called the AMRC, and we are also members of this large grassroots OSH network in Asia called, I'll talk about it a bit later, that's the one on top, ANROEV, the Asian Network for the Rights of Occupational and Environmental Victims. And it has membership from 14 countries in the Asian region and associate membership from other parts of the world, including the Hazards Group. And that's why we've been invited to come here. So I'm going to explain a little bit how we work. AMRC is a regional organization, and then in all the countries we work, we have ongoing programs on occupational health and safety in East Asia, in Southeast Asia and South Asia. So we have partners in all the different countries, and not only that, we are actively developing national OSH networks. Right now, we've done it in China, we've done it in India, and now we're doing it in Indonesia. So we try to get together victims groups, trade unions, workers groups together to form informal networks so they can push for higher health and safety standards within a country. And then finally, these organizations who are our key partners work directly with the victims and workers at the ground. So, and then of course you have the network on top, ANROEV. And now we are going one step further, which I will explain later. We are right now discussing and trying to form a global occupational health and safety network. And we've just started discussing it, so it will be formalized probably a year later. So this is us. AMRC has been in Hong Kong since 1976. It was set up to promote and support a strong democratic and independent labor movement in Asia. And we are an information resource center. We carry out participatory trainings, research, advocacy campaigns, and a lot of publications. And our areas of work are not just only occupational health and safety. We also do a lot of work on informal organizing, looking specifically at the informal sector, because right now in Asia, majority of the workers fall in the informal sector. Very few are organized. So it's like 80%, more than 80% of the workers are informalized. In the other programs we work on labor law and social security, and transnational corporations and monitoring the supply chains, and how that translates to workers at the ground and affects their rights at the workplace. So this is a little bit about our background. Like I said, we were set up in 1976 by American missionaries. And over a period of time, the organization evolved and it's become what it is right now, mainly as a response to what it sees as the key labor issues in the Asian region. And now we are called Asian Monitor Resource Center. These are all the main activities which I mentioned before, what we do. And our programs. In South Asia, we are there in India, Pakistan, Bangladesh, Sri Lanka, and Nepal. In Southeast Asia, we are there in Thailand, Cambodia, Vietnam, Philippines. What am I missing? Indonesia. Yeah, and then in East Asia, in Taiwan, China, Japan, Korea. That's about it. And now we are starting to develop programs in Burma also. So, in terms of the occupational safety and health program, what we're doing is we work with trade union and worker organizations to inform them and to empower them to bargain for better working conditions that are safe and hazard-free, and for victims to get recognition and justice. Because a lot of times what happens is, one, because work is so informalized and workers are forced to move from one workplace to the other, when they actually fall sick, it's really hard for them to get any sort of diagnosis, compensation, or treatment. And then victims and labor groups and NGOs, this is the ANROEV network. I'm going to explain a little bit more about it. What we are trying to do is, by bringing together all our partners from the network, we've created this large network in the region, and we have active campaigns running on electronics, on asbestos, on silicosis, on chemical poisoning. So let's, for example, I was in Indonesia in mid-June. We went to visit a factory which is in the export processing zone, which is really close to Singapore. It's called Batam. And this factory makes batteries for the European Union. It's a German factory. The chemicals being used in that factory are completely banned in the EU. They cannot be used. But over there, the workers have no idea what they are using. A lot of times they have, it's just bottles with ABC written. They are asked to mix them and they use them. There's cancer clusters in that factory. I met a woman worker who's gone through a double mastectomy. And I spoke to a couple of men who say they have brain cancers, but we don't know. It's just the start. Now we're going to take in doctors to examine the workers to determine the situation. But the key thing I'm trying to tell you with this story is the need for international solidarity. Once we do this, and once we identify that this is what this company is doing, then we link up with our partners in Europe, and we can actually target that company to get them to change the conditions in their factory. And we will do that. And what we are going to push for is, if workers are sick and dying, like for example in Bangladesh, for criminal liability of the employers. This is one of the active objectives of our network and what we are working towards. And a huge problem we have in Asia is there's not enough doctors or lawyers. People fall sick, they can't get the right treatment and diagnosis, because when they go to the doctors who are associated with their factories, the company doctors, if it's silicosis or pneumoconiosis, they are usually diagnosed as having TB. And TB is not an occupational disease, therefore they cannot get anything. And this is pretty standard. So we need to really build the core group of doctors and lawyers in the region. It's a huge gap right now. And we have done this in the past 2 years. I'll speak about it a bit later. And also the network is now called ANROEV, which means the Occupational and Environmental Victims. And this change happened in 2010. Because before that, we were an occupational accident and accident victims network. That's what we were called. And but we see, if we are trying to push for a higher standard of health and safety in the region, we need to come together with the environmental sector. Because a lot of time when you're talking about electronics, for example, the pollution doesn't just happen in the workplace. It goes into the environment, the communities are affected. So there is a very, very urgent need to link up with environmental groups, and that's what we are actively doing now. We are bringing in more environmental groups into our network. So the reason and the impetus for starting the ANROEV network was there were two very bad industrial fires. Well, not bad anymore, because now we've had Rana Plaza and Tazreen and Ali Enterprises, which is a lot worse than what happened 20 years ago. There were two fires in China and in Thailand, the Jiri fire and the Kedah fire, where hundreds of people died because they were locked up in their workplaces and the fire started and they couldn't get out. And the groups which were involved in OSH saw the need to set up a regional network to bring victims groups together. And one of the key things of our network is we provide support and give resources to victims groups so that they are empowered, they form organizations on their own, and they are sustainable. Because if we try to go in and do something, it's not long term, because we're not from there. So what we do is we try to consciously build sustainable victims' rights groups in the different countries we work in, and that's how the work goes forward. So this network was set up because of these two industrial fires, and like I said, we have membership in all these countries, and these are our ongoing campaigns. Now, what do? We have Now we've made it biennial, the meetings, because it's too much of resources and we'd rather put it into the ground to help organizations that organize annual conferences. So now it happens once in 2 years. But what we do is we bring all our partners and the member organizations together, very similar to this meeting, where we have workshops where people share about their ongoing work, what kind of struggles they've gone through, what kind of strategies they've used to get justice for victims, and it can be organized into various topics based on what the members see as the need. We just facilitate the process, but they choose it, they facilitate it, and that's usually how our biennial meetings take place. And it's usually on occupational lung diseases, electronics, mining, victims organizing. These are the areas normally we have our meetings on. And then of course we have joint solidarity campaigns where our member organizations, if someone's, let's say a factory closes down and the employer has disappeared, and if it's a company from Hong Kong, which has happened, then people could possibly come across the border from China and ask the Hong Kong groups for help, and then we organize an action outside the employer's office. Likewise, this can happen in other countries. It happens in Indonesia, and our friends in Vietnam support. So these kind of ongoing active campaigns is there in our network, and it is really the only OSH grassroots movement in Asia right now. Now, the situation in Asia with regards to occupational safety and health. OSH rights, as you know, because of the crisis, it's really not a priority. They are actively trying to dismantle health and safety, controls, trying to give the, for example, self-regulation. Because the governments don't want to put enough of resources, for example, factory inspectorates, what happens is they actively ask companies to start monitoring themselves. And that is in no way going to help the workers at the ground. So, for example, the Ali Enterprises, I don't know if you saw it on the news, that company, a couple of weeks before the fire, it got a certification that it was safe. And this certification was given by Social Accountability International, saying that it's safe. And right after that, there was a fire, and so many workers died. So this is a result of the government's not doing their job and handing it over to companies and these kind of agencies which certify workplaces as safe and don't really do anything to actually go in and check the conditions, and then you have horrible disasters like this where hundreds of people die. And so there's been cost-cutting measures where health and safety has been cut back in the workplace. Workers are losing their jobs, and more workers getting precarious, and the working conditions are definitely a lot more hazardous than it used to be. Informalization, I was telling you earlier. A lot of the industries right now, workers are dispatch workers, contract workers, informalized, and in many of these industries, the workers are women workers. Like the factory I went to in Indonesia, nearly 90% of the workers were women workers. So there is if you look at the laws, a lot of the laws look fantastic on paper, but when it comes to implementation, the law doesn't really have any teeth. So employers can use all the loopholes possible to get away and not be held responsible, and we see that happening time and time and time again, all over. It's the same story in every country. No country is any better than the other. And then, and they're dismantling all the institutions. In Cambodia, the factory work inspector's salary is less than that of a government worker in the factory. Now, how do you expect them in these circumstances to do their jobs properly? They all accept bribes. They all take, handouts wherever they can get. And it's really tough. You can see the situation. It's like the system is working to push them down, and it's really horrible. And they're actively cutting down the number of factory inspectors. And there's not enough people to go by, and sometimes factories don't get inspected for years and years in an end. Self-regulation, this is what I was telling you about. Okay, I'm not going to go into that because I already explained that to you. And, okay, compensation. Majority of workers don't get any compensation. And there's a lot of work. I mean, if you look at the systems in the countries, workers are contributing towards social security, towards insurance, but when it comes to them actually falling sick and using the mechanism to seek compensation, it's too complicated. What happens is, for example, in China, if you're a worker, say working in Shenzhen, and then you fall sick and you get like silicosis or asbestosis, and then you need to go to the local hospital, which is close to your workplace, which your factory is connected to. That's the only place you can go to get diagnosis, to access the compensation and the system. But what happens is, like I said, a lot of times the doctors are hand in glove with their employers. So they get the wrong diagnosis, but they're not getting any better, and they're taking the wrong medication. Then they will go back to their home province. This has happened so many times. When they go back to their home province, they go to the hospitals over there for treatment, and when they do, they find out they're actually sick, very sick. They have an occupational disease. And they come back again to the place where they used to work, and the workers are just made to run back and forth because they have to prove the link that the disease they have is connected to their job. If they cannot do that, then they will not get diagnosis, compensation, and treatment. And this is the kind of odds workers are fighting against. And, okay, I'm not going to go into this. So the other thing is insurance. The medical insurance, for example, in Indonesia, it's called Jomsostek. There has not been a single case of occupational disease ever in the history of Indonesia. Is that possible? But that's true. That's true. They don't pay out any money. And in fact, in Indonesia, the money is taken and invested in buying a bank and McDonald's. This is what we're doing with workers' money over there. It's crazy. It's really crazy. Okay, so now I'm going to tell you a little bit of what our network has been doing. As you know, last year we had the Ali Enterprises, the Tazreen fire, and then we had the Rana Plaza collapse, building collapse early this year. What the ANROEV network did, along with our partners in Pakistan and Bangladesh, is rather than just targeting the companies and asking them to, give compensation to the workers, which is one way of doing it. The other way is, of course, we have to strengthen the existing system on the ground. If the government is not taking care of its workers, if factory inspectors are not in place, if the existing mechanisms don't work, and we just have intervention from outside, this is not sustainable. These fires and accidents are going to keep happening over and over again. So what we see as a way forward for really helping workers and victims at the ground is to build victims' rights organizations. So we've put organizers in place, and we've contacted all the survivors of the fire, and they are setting up their own independent victims' rights group right now. Okay, so I'm going to skip then. I have a lot to tell you. Okay, so that lady over there was one of the victims from the Tazreen fire. She jumped out of the 3rd floor, and she was 3 months pregnant to survive. And luckily, her baby survived that jump. And these are all the people we met. That's the factory. They came out of those windows. Can you see that? That's where the exhaust fans were. They pulled that out with their bare hands and jumped out from the 3rd, 4th, and 5th floor. That's how people survived that fire. Now, in the electronics sector, Samsung is a big, bad company. There's been lots of cases of breast cancers, and workers dying because of breast cancers, clusters, just like we are seeing now in Indonesia, very similar. So we have to connect these people soon once we investigate the situation. And there's active campaigns going on against Apple and Samsung.
I'm sorry to be cruel, I'm really going to have to ask you to wind up.
Okay, so just 1 minute. I'll just finish it.
Yes, absolutely. 1 minute.
1 minute. Okay. So this is a factory in Indonesia I was telling you, which is making the batteries, where the ladies are all got breast cancer. And then of course we have an ongoing, very strong campaign on asbestos. And this is controlled use of asbestos in Asia. Workers touch it with their hands. No ventilation, no safety, nothing. Shipbreaking, again, workers handling asbestos with their hands. We have a mining campaign, and we have had exchanges of mine workers from China to India and India to China. Capacity building, a lot of trainings we do on occupational safety and health. Likewise, we had an exchange of victims of silicosis who went from India to China and China to India, and that led to safe mechanisms they developed to prevent the dust from coming out, and it's actually led to an increase in, it's made it safe. Okay, the rest of it, please come and talk to me. I'll tell you more.